Hi, good evening. I'm Dr. Kaushik here. I'm a senior consultant rheumatologist at Apollo Hospital. I'm trying to do a series of videos where we want to explain about fairly common conditions which we encounter in our rheumatology clinics. One of the most common problems we have, for which we see patients with, is rheumatoid arthritis. Rheumatoid arthritis has got a prevalence of around 1% in the normal population, which means for every 100 people we see around one patient with rheumatoid arthritis. I'm sure people have heard about rheumatoid arthritis being mentioned everywhere, different kinds of arthritis being mentioned. So what is rheumatoid arthritis? See, rheumatoid arthritis is a condition, it is an inflammatory condition, and inflammation means there is swelling affecting various joints in the body. So it is a chronic inflammatory condition. Now, why do people get rheumatoid arthritis? Rheumatoid arthritis is what we call a autoimmune condition, which means within our body, all of us have what we call an immune system. This immune system is meant to protect our bodies from various diseases like infections. But in some cases, this immune system can be activated to attack our own body. And one such disease is rheumatoid arthritis, where the immune system affects our joints. Now, why should certain people's immune system cause rheumatoid arthritis while others don't get it? Now, this is an age-old question, and it's very difficult to answer. Now, there are lots of theories being proposed, and one of the most common reasons is a genetic predisposition. So there is something in the family which predisposes a person to arthritis. But do everyone with that predisposition develop arthritis? Maybe not. So what happens is there is something in our environment which comes and sort of triggers that predisposition. So it could be an infection, it could be a chemical, it could be stress. But what it is not same in every person. So this in fact causes problems in formulating a treatment. So there isn't a single treatment which would be effective for everyone. So we need to tailor-make treatments for every person. So now we saw what is rheumatoid arthritis and who gets it. Now, what is the cause for rheumatoid arthritis, but who actually gets it? Is it seen in men? Is it seen in women? Is it seen in young people, old people? Actually, anyone can get rheumatoid arthritis. Although it is more common in women, it affects men, it can affect people of every age group. The very young, the very old, everyone can get rheumatoid arthritis. So we just have to have a clear watch out for the early signs. We pick it up, and the more sooner we treat it, the better results we get. Now, what actually happens in the joint? Now, for this, I think it is better I could explain it with a small a diagram, if you will. So next to me, we have a computer where, now this is how a normal joint should look. So we have two bones, and within the bone there is this cartilage. Now the joint is surrounded by what we call a capsule, and the capsule is lined by something called a synovium. Now the problem in arthritis is that synovial layer gets inflamed. It becomes swollen, and it becomes very irregular. So you can see the picture to the right. It clearly says the synovium is slightly inflamed, and this leads to what we call loss of joint space, and this is what we see in arthritis. Now, if I could show you a real life picture of how an arthritis should look. Now here is a picture of what we call an arthroscope. So here a surgeon has inserted a camera into a real life knee joint, and you can see how smooth everything looks. Now brace yourself. This is how a rheumatoid arthritis looks like. This is a rheumatoid arthritis of the knee where the synovium is swollen, and this is what causes swelling and problems of pain and stiffness in the joint. Good. So now rheumatoid arthritis causes stiffness, loss of function, loss of mobility, and loss of work, loss of employment, because people find it difficult to continue in their jobs. Now, should this be a constant thing? Can we do something to help these patients? Sure. There's lots of newer treatments available. There's lots of treatments available. Now, there is this sort of a popular belief, if you will, or an urban myth saying that there are no treatments for arthritis. Is that true? No. There are lots of treatments for arthritis. But the most important thing is early diagnosis and institution of the right treatment, a tailor-made treatment for that person. Patient education. Now, treatment of arthritis is not like take this medicine and you'll be all right in the morning. So it is a long-term approach is what we need to ensure maintenance of the joint function and control of the problem in a person. So essentially, we sit with the family, we sit with the patient and talk to them in detail on the available options and how to appropriately use the medicines. Can we cure arthritis? Yes. I mean, this is the new age of medicines. So what we talk about is something called induction of drug-free remission, which means we control the arthritis and at some point we should be able to withdraw the medicines. How long will that take? Now, it depends on each person. It could be 3 months, it could be 6 months, it could be 2 years, but that is the aim. Can we stop the medicine at some point? Now, for this kind of a novel approach, we do use the newer kind of medicines. These are called biologic medications. They are available in injection forms, like injections which go under the skin or injections that can be given in the vein. Different approaches are available, but they do a very good job. Now, who do we give them to? What are the precautions we need to take? For these, I would recommend you speaking to a medical professional, preferably a rheumatologist. Then comes the question is, who's the best person to treat arthritis? Do you need to go to a general physician? Do you need to go to a rheumatologist? Do you need to go to an orthopedic surgeon? Now, being a rheumatologist myself, I would say the best person to treat a rheumatoid arthritis with a wide knowledge of skills and different approaches with the knowledge of newer medications, I would say go to a rheumatologist. Do come, get it assessed properly and treat it. Now, apart from actually treating the arthritis, we have to also look at the associated problems. Now, footwear, are we given the right splints, workplace assessment, home assessment. There's lots of intricate details which we look at. So, do you need to worry about arthritis? Yes, early diagnosis is key, but you don't need to be afraid of arthritis because there are treatments for it. They can be controlled significantly and things have come a long way in the recent years. So, please don't be afraid of arthritis. If there are any symptoms of joint pain, stiffness, swelling in the joints, please do contact a medical professional as soon as possible. So, I'm going to close this video with this final thought. Any hint of pain, any swelling in the joint, do contact a medical professional. Thank you very much. Bye-bye.